I've worked with a lot of stroke survivors over the last 8 years, and one question that almost always comes up is, why didn't my doctor tell me that? Hi, I'm Elise. I hold a clinical doctorate in occupational therapy, and I'm also a certified stroke rehabilitation specialist. Today, I'm going to cover the top 10 things that your doctor probably didn't tell you after your stroke. Before we jump in, please make sure to support the channel however you can. Like this video, subscribe, become a channel member by clicking the join button, or leave us a super thanks by clicking in the YouTube bar below. All right, let's get into it. I do want to quickly say that I don't think most doctors are intentionally not trying to tell you things after your stroke. They're subject to the failings of the healthcare systems just like therapists are. But do I think that this is an excuse? No. All healthcare professionals have a duty to provide the best care that they can for their patient. So with that said, let's get into number 1, identity. The psychological impact on your identity and your self-perception after a stroke is huge, and it rarely gets talked about in medical settings. Things have likely changed for you after your stroke, maybe in small ways, maybe in big ways, and your roles and identity may have changed as well. For example, if you were a provider for your family before your stroke, but now you require a caregiver, it can bring up a lot of complicated feelings like guilt, shame, depression, and a lack of self-worth. When your identity changes, you can feel lost. I want you to know that this often gets better over time as you get to know yourself again. And it can be very helpful to have family support, people you can talk to, and a mental health therapist can also be exceptionally helpful. Number 2, sleep. Sleep issues can actually develop as a result of your stroke. An article published in the Stroke Journal found that around 36% of stroke survivors reported having insomnia at around 3 months after their stroke. They also found that around 66% of stroke survivors in the chronic phase, 6 months out, had mild sleep-disordered breathing issues like sleep apnea, while 25% had severe issues. And you know, when you have issues with sleep, it can directly impact your quality of life. But for survivors, it can also impact your recovery as well. And when it's left untreated, it can actually contribute to a recurrent stroke. And I'm not saying this to scare you, I just bring it up because we need to be made aware of these things, especially if your doctor didn't talk to you about it. So if you feel like you're having issues with your sleep, please bring it up to your doctor, as there might be treatments or medications that can help. Number 3, neurofatigue and cognitive changes. Both of these things can impact you in ways that other people can't see, which can be frustrating in itself. But almost even more frustrating is that you may never have heard that neurofatigue can develop even months after a stroke happens. So when it happens to you, you're like, why didn't anybody tell me this? Or you may become frustrated at the way cognitive changes impact your ability to live your everyday life. Likely no one told you how troubling it can be to get daily tasks done, or remember a grocery list, or create a grocery list when you have executive functioning issues, memory problems, or attention issues. But there are a few things that you can do. For neurofatigue, utilizing energy conservation strategies can be super helpful to help you manage your energy for the things that you actually want to do by planning and prioritizing what you need to get done. You can also try to very slowly increase your physical activity over time to help beat the fatigue inactivity cycle. For cognitive changes, you can use some compensatory strategies like setting reminders, alarms, using a calendar to help you remember when you need to get things done and when you have appointments. You can also try things like memory games or actively practicing your attention during a conversation to help improve those skills over time. Number 4, sensory issues. Sensory overload or hypersensitivity to stimuli is most often associated with autism spectrum disorder, not stroke, and it's rarely discussed by therapists or doctors. You're not crazy if you start becoming overwhelmed by bright lights, loud or repetitive noises, crowds, or strong smells. Your brain simply isn't able to process sensory information that's incoming in the same way that it did before your stroke happened. If you experience this, you are not alone, and it is so often left out of stroke recovery conversations with doctors. If it's causing you to socially isolate, avoid going out to stores or being in crowded spaces, there are a couple things you can try. Wear noise canceling or noise dampening headphones when you're out in loud spaces. Wear sunglasses when you're out in bright environments. Try to slowly acclimate to more crowded spaces. For example, this could mean meeting a friend in a quiet coffee shop versus a busy, loud restaurant. Number 5, spasticity. Now this can come as a real shock because spasticity can actually develop later after a stroke has happened, or it can actually worsen over time. And that can come as a real shock, especially if your doctor didn't tell you to be on the lookout for increasing spasticity symptoms. And survivors are also usually not told about the mechanisms behind spasticity. Essentially, it is this overreactive spinal stretch reflex, which causes involuntary muscle contractions leading to tightness and stiffness of the affected muscles that gets worse with quick movements. It happens because the brain just simply can't communicate with the body in the same way it did before your stroke. Spasticity may require ongoing Botox injections, splinting, bracing, etc. And while there isn't evidence that shows slow stretching can fix spasticity, it may help to relieve pain temporarily, to manage your spasticity on a day-to-day basis, as well as to prevent contractures from forming, which is where there is a permanent shortening of muscles and tendons. Number 6, pain. It can be so upsetting to have had a stroke, recognize it as a brain injury, and then develop acute or chronic pain on top of it and not have been warned that that was even a possibility. And it may also be hard to understand why you have pain in your shoulder when your brain was injured. This could happen for a number of different reasons. Might be secondarily to an orthopedic issue that develops, like a frozen shoulder, rotator cuff issues, or shoulder subluxation. Or it may be due to a neurological issue, like central post-stroke pain or neuropathy. And especially in the case of central post-stroke pain, it can be so frustrating because that can actually develop months after the stroke has happened, and you might not even realize that it's connected. Now, there are a wide variety of different treatments for post-stroke pain. It will depend specifically on the type of pain that you're experiencing. So even if your doctor did not tell you that developing pain was a possibility after your stroke, if you start to experience new pain, please reach out to them to see what treatments might be appropriate for you. Number 7, mental health and emotional lability. This is one of the least talked about areas of stroke recovery, and I don't know why, because it's hugely impactful on the way that somebody survives and thrives after their stroke. It may not be just an emotional reaction, although a stroke is a life-threatening event, and if you develop fear or trauma from it, that's nothing to be ashamed of. However, your mental health can also be neurologically linked to the area of the brain where your stroke occurred. Regardless, a stroke can cause you to mourn your pre-stroke self. You may even go through the stages of grief. Post-stroke depression happens in around 30% of stroke survivors, and around 25% of survivors experience post-stroke anxiety. Emotional lability can also develop, and this is where you might cry or laugh at the drop of a hat. Maybe you can't stop crying, or you have an inappropriate emotional reaction to something, like laughing at something sad. It's really important if you experience these things to try and be open and communicate your feelings to others so that they can help and support you, to reach out to a mental health care professional, someone who actually knows how to handle what you're going through and give you evidence-based tips on how to deal with these things. And lastly, just try to give yourself grace and kindness because you have been through something very traumatic. Number 8, stroke recovery isn't linear. Stroke recovery doesn't go from point A to point B. There is no prescribed timeline that every stroke survivor is going to follow, and that can be really frustrating because you don't know what to expect. But what can be almost even more frustrating is not having anybody tell you that. It looks more like a roller coaster where you're going to have hills and valleys. backslides, and moments of huge progress. But the good news here is that stroke recovery does not have an endpoint. Unfortunately, I still hear from survivors all the time that their general physician, or even their neurologist in some cases, tell them that they shouldn't expect any stroke recovery after the first year, which is simply not true. Number 9, stroke recovery is slow. There is an initial state of heightened neuroplasticity where the brain is making really fast changes that happens in around the first 6 months to a year after the stroke occurs. And after that, progress starts to slow down, and this can be super frustrating. And again, it can be more frustrating when nobody told you to expect that happening, but it's just the way that the brain and the body heal. Understanding this can help you prepare for when this slowdown occurs so that you're not super frustrated by it or saddened by it. And if you're well past the 1-year mark, it can help you have more realistic expectations about the speed of your recovery. Number 10, progress is always possible, but it takes action. Positive neuroplasticity, aka the brain's ability to create new pathways and reorganize, requires work and input. Use it or lose it. Use it to improve it. But if no one ever told you this, you may end up developing something called learned non-use. And this is where you learn to not use your affected abilities. It's a type of maladaptive neuroplasticity where your brain will actually prune away pathways that it deems aren't important because they're not being used. But here is the good news. If you start putting in the effort and taking action to use your affected abilities, progress is always possible. It might happen slowly, but it will happen. Leave me a comment and let me know. What did your doctor not tell you about after your stroke? And of course, a huge thank you to all of the donors who make this nonprofit possible, with a special thank you to Heather G, Ryan D, and Modus Nova in our Empowerer tier on Patreon. Thank you all so much for watching. I'll see you next time.